Good afternoon, and thank you so much for having me come. I am in charge of information and assistance for the Chester County Department of Aging. As well, I can tell you that I've kind of walked this road. I can't say that I was like the hands-on caregiver, but my dad went through the process of getting services from the Department of Aging just shortly before I came to work there, and had to go to a nursing home and, passed away in the nursing home. So I have kind of, at least my mom was still alive. So as I said, I wasn't the hands-on caregiver, but I certainly bore a lot of the stress along with her in walking that road. So, I understand that it's a difficult position that all of you are in, and I hope that if it's nothing more than talking with us or calling us for information and other resources, that we can certainly, be of help to you. That's what we're there for. The Department of Aging serves several different functions. We are state mandated to have some functions, and the ones that we are state mandated to have are information and assistance. We assess people. We determine the level of care for people. Even people that are under the age of 60 that are considered disabled, we actually assess them, but we don't serve them. We just pass on the information after that. We also are state mandated to do older adult protective services. It's probably the least favorite, at least from my view, part of our job. It's very difficult. We investigate elder abuse, and that abuse can involve abuse or neglect. So sometimes it's a case of someone, they're alone, they're either not letting people into their lives, or they don't have anyone, and they're actually self-neglecting because they just can't help it. They may just be very stubborn, but they may have dementia, or they may have other factors that are not allowing them to take care of themselves. And it is a really growing problem. The main kind of abuse that we're seeing at this point is financial exploitation, sadly often at the hands of the person's own family. And we actually have 4 full-time people at this point investigating elder abuse. It has grown from just the general care management staff helping with that as a side light to what they do, maybe 8 years ago, to now 4 full-time people. And obviously this population is increasing, but also the problems are increasing. We do provide care management to people, and we do that under 3 different programs. The bulk of the people that we serve are served under the waiver. It is now called the Aging Waiver Program. The state has changed some things about the departments that we're under. It used to be called the Pennsylvania Department of Aging Waiver, but we actually now are under the Office of Long-Term Living, so it's just referred to as the Aging Waiver. That program gives the most amount of service if people need it, but it also has the most strict qualifications. Someone has to be medically eligible, and that would be determined by our assessment unit. They have to be what we call nursing facility clinically eligible. And basically, if you just look at it in a nutshell, if you took the person and they did not have informal supports, you're all probably helping your loved ones stay in the home. If you took that person and took away all those informal supports, and they basically could not take care of themselves, they couldn't bathe, dress, groom, or make safe decisions. The lady who's wandering down the street, we had a lady recently who was going to Brooklyn, was reported to the police. If she didn't have family to live with, she probably would not be able to be in her home. So they have to be at that level of care, nursing facility clinically eligible, but they also have to meet some pretty strict financial criteria. The income level, it is much above being on straight Medicaid. You can actually make, I believe it's around $2104, somewhere right in that area, is the monthly income. And that is only for the person. So in other words, if that person has a spouse that also has income, that income does not count. It would be that person's. And there are really a lot of seniors below that. That's a pretty high level when people are a lot of times just living on Social Security at this point. Even some people that are getting Social Security and a small pension. But you also, as a single person, can only have $8,000 in assets. Now that is beside a home that you're living in and a car, one car. In the case of when someone has a spouse, it gets a little bit complicated. There are some formulas that they use. So what we do is we just submit those spousal cases. Even if someone has $150,000, $200,000 worth of assets, we submit them to county assistance and kind of let them sort it out, because there is a provision called spousal impoverishment that allows that other spouse to keep, and it's above $100,000 at this point, that the other spouse is allowed to keep. So, you know, we don't pretend to try to ferret out those, and it depends where the money is. Sometimes an IRA counts, sometimes it doesn't count for the spouse. So, you know, we don't get involved in that. We send it to them and let them make that decision. The waiver program provides a lot of service for people. They can get personal care in the home. We have people getting up to 40, this is very unusual, but up to 40 hours a week. You know, some people may only get 6. It depends on what they need. If they're alert and oriented and they just need, you know, I can't take my shower safely, or maybe I need someone to do a little bit of meal prep. Some people can get by with 2 hours a day, or even some people don't want service every day, but they just kind of need to be checked on. Then you might have a person who literally cannot be left alone. And maybe they have people such as you, adult children who are caregiving, and we can provide service then while you're at work. We also provide for a lot of people the ability to go to adult daycare. It's a really good option for people, especially people who have dementia. It keeps people, you know, them cognitively stimulated. It gives them a way to socialize. You know, people often really squawk at the idea, especially if they're not, you know, really far into dementia. Sometimes even the caregivers are very reluctant. But once they get there, they really usually like it. I wish they would change the name. I think that's the problem. You know, it should be like the Adult Day Center, because no one wants to feel like they're being treated like a child. And I've heard consumers get really hung up on that. You're sending me to daycare? But that's one of the things that we can do. We also can provide some meals. We pay for people to get Meals on Wheels through that program. There's another meal program called Mom's Meals that come frozen, and the people can just heat them up. And we also provide some medical equipment. We can provide lift chairs, stair glides, some other, and we'll facilitate also some of the medical equipment that really may be paid for under Medicare, but if you have that care management, they'll kind of get involved. We'll get an evaluation through the program, you know, an OT or PT evaluation, and we'll see, you know, do they need a shower chair? Do they need grab bars, that kind of thing? So those are some of the things that we look at. And also, because the person now is entitled to Medicaid, their prescriptions wind up being cheaper because they're literally being served through Medicaid. And also any kind of products, we have a whole list of products that you can order, and those are just covered under Medicaid. Especially a big help to people is it covers incontinence products. And they can be very expensive. So they just come monthly. I mean, the consumer or the family usually deals with that, just calling the company and dealing with it. If we have to get involved, you know, because someone can't, we will. For the people that don't qualify for the waiver program, either because they're just a little below that level of care, or many times it's because they just have a little bit too much in assets, we have an options program, and that is funded, obviously the Medicaid funded program is a federally funded program. The options program is funded through our state block grant. The only problem right now with the options program is that we have a pretty long waiting list. Money has been very tight for the last couple of years, and I'm sure all of you being involved with the government know kind of how it works. Like, we are just finding out now for the fiscal year that started in July really where we stand. So we go back and forth between, you can spend money, no you can't spend money, you know, you can take people off the wait list, no you can't. And we do take people off the wait list in order of need. So the neediest of people, say someone just has a little bit too much in assets, they can't even take their own bath, they might get off long before someone who's been on there for 2 years, but they really just need someone to come in and do some meal prep, home support, that kind of thing, but they can take care of themselves. So we kind of feel like that's the most fair way. We assign a score when they're assessed, a functional needs measurement score, and that's the way that we take people off. And sadly, very often anymore, when we go down the waiting list, people have either passed away or they've been placed in a nursing home, or they're, you know, something's changed, they've moved, because we have had people on the waiting list for, at this point, years, which, believe me, we wish wasn't the case. We have a third program that's on the smaller side in terms of how many people, but it is a good program. The problem is it's a reimbursement program, so you need to be able to put out the money for the program, and it's called the Family Caregiver Support Program. The criteria, one criteria especially, is that there has to be someone who provides daily hands-on care to that person. They don't have to live with the person. So in other words, if you're a daughter who lives in the same town, but every day you go over when mom takes her shower because she can't manage, you qualify as the caregiver. It's not a program to pay you, it's a program to give you a break. So in other words, if you want to hire an aide for a couple of hours and you can put out the money to pay that aide, then you submit your receipts to us and you get back money. The maximum amount that you can get back is $500 a month, and that depends on income and some other factors. One of the issues is if your parent lives with you, the unfortunate part is that everyone in the household's income counts. So that kind of really counts out a lot of people that maybe live with a spouse and their or a child and their spouse. You know, it winds up being sometimes too much income, and then there's not, you know, a very high level of reimbursement. But if a parent lives maybe by themselves, or you have a couple, if you have a couple living together, it generally works out, because especially if the family's putting out money, they might be putting out, everything counts. We take deductions toward how much they'd have to pay. So all the money they put out for medications, any services they're hiring, and lots of other things count as deductions, taxes, you know, so lots and lots of expenses can go against what they would have to pay. It's like a level, you may get reimbursed at a 10% up to a 100% level. And we're trying to grow that program, and we really are trying to encourage people. If you qualify for the waiver program, you can choose family caregiver, and some people do, because there is a state recovery with the waiver program. So in other words, if you have a couple and they own a home and the person gets services, after both the couple pass away, there will be a bill levied against the estate. People have the misconception that someone's going to scoop in and take everything they have, like they're going to take my home. If they have a $300,000 home and they only got $60,000 worth of services, they're going to get a bill against the estate. They're not going to take their home. So some people really get a little bit afraid of the estate recovery issue, and they choose family caregiver instead of waiver. I think, unfortunately, the issue with that is people don't want the waiver services, and they wait, and they're really vulnerable. I mean, sometimes almost to the point of, you know, we think them almost being unsafe, especially when there's not a child involved, when it's a couple. And then, unfortunately, they get so sick they have to go to a nursing home, and the same thing applies. If you have to go to a nursing home, you're going to have to apply for a medical assistance grant, you know, because it's basically costing about $300 a day now to be in a nursing home, and that estate recovery is going to apply anyway. So sometimes I think people would be far better off just saying, okay, you know, we're going to deal with this. This is how what it is, because the bill's going to be far less for the waiver services because they're not costing nearly as much per day. Our average care plan for a waiver consumer is probably in the area of less than $2,000. You know, if you're paying at the Medicaid rate, I think it's close to $200 a day for to be in a nursing home. So obviously that's like a $6,000 bill. So unfortunately, you know, people get, and that generation, I think, of people who are, you know, like would be my parents' age, they were, you know, they lived through the Depression, a lot of them. They worked very hard for their money, and they find it very difficult, I think, to have that concept that someone's going to take their money. We so often have conversations with people where they say, I'm not spending my money, I'm saving that for a rainy day. And there are so many times we say to people, it's raining. You know, like, you really need the help, because, you know, they want it for free, or they think they're just going to manage without it, and they really can't. So the other thing that we do, like I said about information and assistance, is we really do have a wealth of information in terms of linking people to other resources. So, you know, please feel that if you have any questions and you want to call us, there are lots of resources out there, because you know, we also know that there's lots of other issues that come up that you may need other resources for. We also have, kind of in conjunction with us, I don't know if you're aware, there's an Apprise insurance counseling program in Pennsylvania, and the phone calls go through our office. They're volunteers, a lot of them are seniors. You call our office, the number is on the brochure, and a volunteer will call you back within 48 hours. And they also counsel people at the senior centers. They basically talk to them about what their options are. You know, this whole I don't know what you call it, picture of the, getting supplements to your Medicare and things. It's very complicated and confusing, and we are absolutely instructed in our office, we are not to counsel people. It's too complicated. We can't all be experts on that, so we try to keep it to people trained. There's one person that runs the program. She's very knowledgeable. She's a contractor under us, but everyone else involved in that program is a volunteer. We also have an ombudsman connected with us. Her job is to deal with problems in facilities. So her number will be posted if you go into any nursing home or assisted living. You can also call the same number. Her number also is linked with the Apprise number because she's also a contractor. Her name is Jen Costello. You can call the number. It's 610-344-5004. There are prompts for Apprise or for Jen, and she will call you back very quickly. They're very good at resolving. Now, not abuse issues. Abuse needs to be reported to us if something's happened, but issues of, my mom they keep giving her food she can't eat. They're not, she's asked and they just won't change anything, or a multitude of issues that happen in facilities that she asked that you try to deal with the facility yourself first, but that's what she's there for, and she gets involved. Jen's fairly new. She's been doing the job for about a year, but she was trained under the person before who had done it for many years. So I think those are the basics of what we have to offer, and I would love to answer any questions that you have.
For eligibility, do they look at the patient or where the family lives? Like, say I had a parent in Delaware and I wanted to move them to Chester County, since I'm in Chester County. What's the eligibility on that?
What they would do is, if you said I'm moving them, you could bring your parent, like say, to your home. We would assess them in your home if you're telling them they're going to move. I mean, if you really have it set up, and then we would consider that their address. As long as we could see them, we wouldn't be able to go to Delaware to see them. If we had an issue where a woman worked for the casinos, the daughter was being transferred here to Chester, to Harris, so she flew her mother here because she had come ahead of her. We assessed her so that we could get the ball rolling, and then she moved her mom here. It may not be seamless. I mean, that's the only problem too with the waiver program, because those applications have to be approved by county assistants. And we all know the wheels of government turn slowly. It's actually, we're telling people to be safe about 3 months from the time you call us until sometimes services are up and running. And we wish that wasn't the case. It can sometimes take county assistants at least 6 weeks to approve a case, and then we have to develop a care plan, and then the state insists on approving the care plan. So that's very frustrating because, I think that people generally call us when they needed help yesterday. And very often because they didn't know what to do, and they get really desperate and they start asking around, and they didn't even know the Department of Aging existed. But definitely, if your intent is to move your parent there and you're providing a Chester County address, that's not a problem.
The different counties have pretty much the same program. So if I live in Montgomery County,
yes.
Could I expect some of these same services?
Yes, absolutely. We run pretty well the same. I mean, little minor, maybe how we might deal differently with the wait list, that kind of thing, but their funding would be identical through the state. And they're trying, actually, they've really made a big effort to make things as consistent as possible. I think that Chester County, and I mean, I'm not saying this because, I mean, obviously I'm proud of our office, but I think we do a really good job. I think, from what we've heard, some other counties are a little slower than us at certain things. I mean, at this point, they've tightened the deadlines for assessments. So literally, if you called us today, your parent would probably be seen within the next 10 days. So, I mean, we're really proud of that we try to, and it very much frustrates us about the lag in services getting started, but that's totally out of our control. And that is also being looked at because the County Assistance Office approves applications for not just our waiver program. There are waiver programs for all kinds of people with disabilities as well as children. So there is a big work group that's working through the county to try to address that issue. And there have been some progress made. I mean, what happens is, unfortunately, they get caught up, they get overwhelmed, and then things kind of fall apart. But it is being looked at and addressed. But yes, the counties work pretty much the same.
I use Medicare a lot. What is Medicaid? I mean, I've never had to use that.
Medicaid is the same thing as medical assistance.
But it picks up what Medicare does?
Yes, for if you would qualify for the waiver. The only people in our office that are served under Medicaid is if you qualify for the waiver program. Unless you qualified for Medicaid just by straight your income, and that's at a much lower level. If your parent like needed medical insurance and they say the only way that they would qualify for that is, I believe, if they were as low as somewhere in about the $800 a month range, you know, if they needed it just for their straight medical insurance. So it's a federally funded program that basically gives people insurance, but everyone who is entitled to Medicare, their Medicare is always their primary insurance. So that will come first, because I'm sure you're aware, if you use Medicare, there are a lot of copays. You know, there's a lot of those 20% that don't get paid, especially for the Medicare A part through doctors.
I haven't seen a bill for, so I'm hoping that's not.
Wow, I think you might, but a lot of people have a supplement that picks those up. That's the thing, but the actual Medicare itself, there really are a lot of, you know, copays. It mostly covers 80% of things.
In my house, my husband's parents live with us.
Okay.
They're 87 and almost 89.
Mm-hmm.
So I watch my mother-in-law, who has severe arthritis. Her bad foot is really bad. She has a brace on there. She can barely walk. Now her right foot is starting to deteriorate, and I see probably within a year she's not going to be able to walk.
Mm-hmm.
So with the severe arthritis that she has, chances are she's not going to be able to take care of herself. Bathroom, getting dressed, and cooking. So I'm wondering, my concern is they have Medicare and Medicaid. She wants home health care if the day ever comes. She doesn't want to go to a nursing home or a rehab facility. So in order for me to provide her with what she wants, I talked to her physician, and the physician said that there's no insurance policy that you can get where you have a pre-existing condition that will cover in-home health care.
Mm-hmm.
That they would have to pay for that out of their own pocket when the day comes.
Do they have assets? Because if you're saying they have Medicaid, that usually means you don't have any assets.
I don't know. I mean, I know that they pinch pennies where, like your initial description of the elderly, they're pinching pennies, and I think they're saving it for a rainy day. I think my father-in-law knows that she's going to need some sort of extra care, but we're not at that point yet.
But when their money ran out, she would be qualified for waiver, and we could give her as much help. I mean, we can't give 24-hour help, but with living with you, more than likely she wouldn't need 24-hour help.
Well, my husband and I both work, so they're home by themselves.
Right.
During the day.
But maybe you could manage overnight when they're in bed, and we could, there could be help during the day.
Okay, and that would be provided.
That would be under the aging waiver program. And you don't even have to know, if you want to make a referral for services, you don't have to know which program you're wanting when you call. You can call and say, like, this is the situation. I have my parents living with me, they can't manage. Try to have as much information as possible, try to get that information about their assets, but we'll come out, we will assess anyone who requests an assessment, and then the assessor can explain the programs and see which way it's heading. So I would highly recommend, when you see that day coming, just call and make a referral.
Joy, do one of you have power of attorney over their financial?
Not yet. My father-in-law hasn't bit that bullet yet.
Yeah, that's hard.
They're still trying to deal with accepting the way that they're aging, and they're very frustrated with how they're getting older, and it makes them angry. And talking about having a living will, we're still working on it, having somebody come and because their world went from this to this.
It does.
And whenever anything creeps in, they get very upset. What is this? What does this mean? What is, I think Obamacare is doing this, you know, and they don't understand what this complicated insurance world that we're having to deal with now.
Right.
And if they don't understand it, and we're trying to
Right.
understand it, it's very, you know, it's like,
Right.
you know, so,
Right.
talking to them about these steps is very, very difficult.
Right, and that is a good point about the power of attorney. And also, we often get people that call and now they're in a really bad spot because when you apply for the services that are Medicaid related, also there's or your parent has to go in a nursing home. There's a 5-year look back at their finances because you know people very often in the past have tried to just give their assets away. So if you have given anything away in the last 5 years, or say sold a home at like a really low value, that's going to be seen. So I highly recommend, especially because all of you were involved and obviously intelligent people, if you have any issues like that and you're dealing with it, contact a really good elder law attorney, because so many people after the fact, we had a case where this couple, the children got in touch with us and said, our doctor told us to sign the house over to the kids. And I was like, so where did the doctor get her law degree? You know, I mean, they should have contacted an attorney. You know, you don't go to the attorney to ask them what prescription you should take. You know, so, and that causes people really a lot of trouble. You know, it was a whole complicated mess. You know, and these people, both of them really needed services. So I really think that you know, it doesn't cost that much to have just even one consultation. And there are several good people in this area. So, you know, I mean, obviously we're in a place where there's lots of lawyers, you know, just make sure that that really is their forte, because I've heard, you know, stories also of people not always giving the best advice that way. You know, make sure somebody understands those rules, because they are very strict about that. The look back has increased gradually. At one point, I think it was 3 years, and now what they've done is like every month it's gone up, and it's just about, I think, to hit 5 years. So basically, if you're a parent tomorrow, something happens, you say your parent gets sick, they have a stroke, something happens, very often what happens is they go in the hospital. The hospital says, well, they need rehab. And rehab, if your parent goes in the hospital and goes to a facility, they get 20 days covered straight under Medicare. But if they have a supplement, depending on how they're doing, if they're progressing and what the insurance is, they could get up to another 80 days. But that's it after that. Then it has to be either they have money or they have to apply for a Medicaid grant. So if that happens, then you're going to be asked for 5 years of bank statements. And that's, you know, kind of a pain in itself, but I mean, they really do stand by that. And it's fair. I mean, at least from our perspective, it's fair when we see people, you know, that have nothing, and then people call and rant and rave at us, well, I'm not giving up my money. Well, you know, that's just kind of how it is. Like I said, it's, you know, your rainy day has come, and, you know, it's not there to protect for your children. It's there to use for your care. But a lot of people don't see it that way. You know, unfortunately, we see the people that, I mean, we have women that we see as consumers that may be making $600 a month and trying to survive, you know, so I guess our perspective becomes different.
I had a conversation with my brother this morning, and he was telling me just what you said. His mother-in-law, she had $20,000. She signed over $10,000 to my brother's wife, and another $10,000 to her son. Okay, and what happened was so those two parties put the money into their own bank account, and the interest that they received from that amount of money, they sent my brother's mother-in-law a check so that she could live on that amount of money each month while she was in a facility. But he did say that they look back at 5 years.
They do.
So the 5-year time period, does that start when you enter a
Yes.
nursing home facility?
Yeah. or you apply for our services, or you apply for the waiver services. Mhm. So even if people have money, we recommend actually that they apply for the medical assistance grant, because what they'll do is they'll determine a penalty period. You're really better off knowing where you stand. So say your parents have $50,000 in assets. It's going to go very quickly to a nursing home. So you really are basically better off getting that application. The nursing homes social workers really are supposed to help you with that process, and most of them are pretty good that way. And you're better off actually doing the process, knowing even you have a little bit of money, and they'll say, so then you'll receive something saying, in other words, in 4 months and 20 days, you'll be eligible because they've decided you have that much money to use. So we recommend doing it that way rather than it being like this last minute frenzy when the money's about to run out. Because I have heard lately, I mean, times are tough economically, and some of the nursing homes are not being, very understanding. I had a case recently where I was working with someone who's a nurse from the Visiting Nurse Association, and the nursing home demanded from her, like, the first month that her mother wasn't covered by Medicare, like, we want $9,000 today. So, it's not good to be faced with that if you can help it. So are there any other questions that I can answer? I know it's kind of overwhelming.
You have a newsletter that you have on your website?
We do. It's quarterly, and it's coming out in April. And one thing to know, I don't know how, and none of you look old enough that this could be the case of your parents, but we are also having, May is Older Americans Month, and we actually have 2 events. We weren't really sure if we were going to be able to do these events, so they are getting planned a little bit last minute. There will be a senior games in May. I believe it's May 23rd. It's in the newsletter. People come and they have lunch, and they're, pretty mild games. I mean, although it's amazing. We have a group of men that play ping pong that are well into their 80s that we're chasing the balls all over for them, and it's pretty amazing. And also on May 14th, we're having a centenarian birthday party for everyone in the county that's 100 and above. And believe it or not, I got the list, and there were 129 registered voters that will be 100 by the time we have the birthday party. I did cross off about 8 of them that we had gotten their replies back last year that I assume they've passed away, but that's a lot of people. We won't get that many at the party because clearly it's difficult for some of them, but we do have facilities that bring some of them, which is pretty neat, because even if they're in if in a wheelchair, they bring them. We give them lunch, they get a citation, they get a flower, we have cake, and I have this really neat music therapist that we used to be able to contract with who's going to provide some entertainment for them. So that's exciting. It's going to be at the Westchester Senior Center.
This is a county program. Are there any federal programs just like this that you know of? The waiver program is federally funded, and really, actually, we operate out of the county, our department, but pretty much all of our funding comes from the state, except for the Medicaid money. So the state, but is there any federal? Not that I know of. I mean, the family caregiver program is also federally funded, but they're not run. I mean, there is an agency and some kind of aging council that's run through the federal, but you wouldn't be able to call and say, like, it's kind of more of an overarching policy kind of thing. They might run trainings and things about policies, but they expect all of us to kind of do the hands-on contact with people. And we are really pretty much 100% funded by the state.
Carol, what's the best way to get in contact with you? Do you have any questions?
The best way to get in contact with the department is to call 610-344-6350. We also have an excellent website that there's lots of information on, and you can actually even make a referral online. We have 2 full-time people that do information and assistance. And they're there and they answer the phones all day. They take referrals. They're a pretty good source of information. We always have a social worker that's on call every day, because the information assistance people are clerical people, and any kind of emergencies. For instance, right now today we are out at a home where there are 28 dogs being taken out of in the county. So very often something like that happens. The SPCA called us. Our on-call worker is out there right now. I just spoke to her before we left. And we're concerned about the consumer who's a senior. We're worried about her mental state. We're worried about if the house is too terrible for her to be in, you know, where she's taking care of herself. So that's the kind of thing that every day we pretty much deal with. And that's even beside our protective services unit.
We had talked before about, I think when I initially had contacted you, 2 or 3 years ago, we had a senior expo down here at Sykes.
Yes.
And the ballrooms.
Yes.
And since that time, I think I've talked to you a few times about that.
We had one other one at this Westchester Senior Center the following year. We chose not to have one this year, basically out of budget constraints, because I mean, even if we have it somewhere where we're not charged to have it, you know, there are some costs involved. We usually have to do some kind of refreshments. The providers, the people that come actually do pay us to exhibit, but our feeling was also we were so tight with money that we didn't want the perception that we had the money to spend on some big, you know, showy thing when in the past we've been able to help seniors with some emergency requests like fuel requests and things. We had a benefactor for a long time that gave us X amount of money per year, and we always had a little stockpile of these emergency funds, and we don't know whether that person passed away themselves or their circumstances changed, so we are very low. And then we've had some other program changes that have really, I mean, we actually had to lay 7 people off this year. So we have really been operating on a shoestring. So we really just kind of made the decision that the expo wasn't a wise idea in terms of, I felt like the centenarian birthday party was far more important if we were going to spend a little bit of money. And a lot of the politicians run health fairs, expos, both in the fall and the spring. There's one actually at Surrey. I don't know exactly where it is, but Surrey Services, so it's somewhere in that area of the Berwyn area. I know it's in Berwyn, I just don't know exactly where. That's April 19th. And